Hey, welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses Barry Houston, proudly sponsored by UTMB Health. Today's special guest is Ezreal. You are with the Community Health Network.
Yep, Ezreal Garcia, Community Health Network.
Tell us about the organization.
So Community Health Network is a private nonprofit health center that focuses primarily on whole person care. So whereas you get your medical care, primary care, dental, pediatrics, all of that, you also get wraparound care in terms of behavioral health, innovative care, remote patient monitoring, as well as pharmacy services.
And how long have you been in this market?
I've been with the organization for 9 years. I've worked in healthcare for close to 15 years already. The organization has been in existence since 2008, started in a little building in Alvin, Texas, and grew to now 13 locations that span 3 counties.
Oh, wow. What's your closest location to the Clear Lake area?
So we actually have 2 close locations to Clear Lake, Victory Lakes and Scarsdale and Beamer.
Okay. Mm-hmm. And I mean, obviously you've been with them 9 years. Talk about the growth you've seen, especially medical industry in general has just exploded.
Yeah. So when we look at growth in 2 ways. Number one, number of patient visits that are accessing the services or accessing, the services that we provide. And the other is number of unduplicated patients. So number of unduplicated patients, as in any health center or any organization, you're looking at individuals that access care for the very first time or are utilizing a service within the organization for a very first time. And so last year we saw just over 90,000 clinic visits, and I can't even remember the top of my head. I think it's close to 40,000 unduplicated patients.
Wow!
So that's a lot of patients that are accessing services. When I first started in 2013, we had 2 locations, Alvin and Freeport, and then here we are 9 years later in 13 locations.
Now, you've got a special niche, right? Because I mean, there's a lot of competition in the medical space, but what do you guys primarily focus on?
Whole person care. So whereas there are organizations that are focused solely on the medical component, whether that's diabetes, hypertension, hyperlipidemia, we focus not just on medical, but whole person. So if the person's coming in for medical care, whether that's acute visit or flu or hypertension or, diabetes, we're going to screen them for other services. So we're going to ask them when the last time they went for their annual well-woman exam, or they're going to ask when was the last time you went to your dental checkup, or how are you feeling today? Are you feeling lack of desire to do certain things? And so those are questions that are kind of trigger questions for us, or identifying factors where we can then loop them into other care services.
Yeah, and so it's a nonprofit, is it? Did I hear? And that's becoming a thing of the past in the healthcare industry too, is my understanding.
Yeah, actually, there are a lot of nonprofit health organizations, a lot of hospital organizations. UTMB, for example, is a nonprofit. Memorial Hermann is a nonprofit. You would not think that they're nonprofit because of the visibility, but every organization in healthcare is committed to making sure that all have access to care, whether it's a choice on their end or whether it's a right on their end. Regardless, we want to make sure everybody has access to care. And so we do it as a nonprofit, making sure that all the revenue that we come in, that comes back into the organization, goes back into cost savings for patients. One of those is pharmacy care, 340B. That's something that's near and dear to our hearts. Most of our health organizations, health centers itself, have a pharmacy. And so we're able to purchase pharmaceuticals for pennies on the dollar and pass that savings back off to patients.
Okay. And so how do people get in touch with your organization? How do they typically find you?
Well, a lot of it is through word of mouth. The other thing is we're really embedded into the community. Our most successful health centers are located in neighborhoods. So the shopping centers off of your major streets, we do fairly well, but a lot of it is us integrating ourselves into the community, hence the reason why we're called Community Health Network. The other thing is obviously through social media and through referral.
And I have noticed you guys have been very active in the chamber, which obviously represents the community. It seems very purposeful. Tell me about that.
We would not be where we are if it were not first for the Alvin Manville Chamber of Commerce and other chambers of commerce when we first started out. I was new to community relations. I did a lot of outreach. I did a lot of marketing, but not a lot of community relations. And there are differences. And so just to be clear, we are a firm believer in chambers of commerce. If it were not for those early chambers of commerce who invested in us and allowed for us to invest in what they were doing and give us a chance, we would not be where we are today. So that's why we're thankful for the Clear Lake Area Chamber of Commerce and the other chambers of commerce that are in our area to help us promote, number one, our services, to promote what we're doing in the community, but also allow us to give even more than what we are already doing 7 days a week at our health centers to the community.
I like the fact that you call it an investment. And I don't think too many people talk about expenses and not investments. And you guys obviously get that you're investing your time and your treasures, and there's a return on that. Talk to me about, you've already said it's been highly successful, but tell me some of the tangible kind of stories that you can give me that it's paying off.
So emergencies have been bittersweet for us. So Harvey, then of course the pandemic. One of the things that has been very beneficial to us as a result of chamber relationships is being able to embed ourselves in government. Now, I'm not, even though we are a private nonprofit who is also a federally qualified health center, we are not a government clinic. Yes, we do receive some state and federal funding, but the majority of our funding comes from Medicaid, self-pay patients, and private pay patients. Whenever these incidents occur, because of our relationship with the community and because of our relationship with the chambers, we're able to establish connections with those elected officials. So, for example, when Hurricane Harvey hit, we saw a need. In Brazoria County, there were shelters open to help address, those individuals who were displaced as a result of flooding. We connected with the county and us formed a memorandum of understanding, and now we are the healthcare provider for shelter operations for those who are in shelters. When the pandemic hit, we were the first organization in Brazoria County to do mass vaccinations. And that's because our elected officials, as a result of the relationships that we've established through chambers of commerce and the investments that we've made into the community, they advocated for us. And so investment isn't just, let me see what kind of revenue I'm going to get in return of the revenue that I'm investing. But it's also an investment in advocacy. Because when you are doing what you are doing and you are becoming better at what you do, what you want are individuals to tell your story to. Because you can tell your story and tell it very, very well, right? Because you're a believer in what you do.
Yeah.
But when you have others invest in what you do and why you do what you do, and they tell your story,
Yeah, I think oftentimes in small business, the point about relationships gets lost. That really building those relationships, they may not pay off right away, but like you said, it gives you access down the road, advocacy, things like that. And that's one of the reasons I've been so involved with this chamber, is because of the advocacy for education in particular. And so I know exactly what you're talking about, being able to make those connections. How did you get into this? Because we've talked about workforce readiness and how the healthcare industry is always looking for people, but did you have a medical background or?
No, I did not have any desire whatsoever to get into the medical field. Actually, I wanted to become a band director. I tell this story often to my team. I received a scholarship to go become a band director, or go to school to become a band director. Through various incidents and situations, I wasn't able to do that. I chose not to do that to take care of some of the priorities that were in my life at that time. I started working, retail, working the restaurant business, and then I got connected with Jay and Lori Carnes from Carnes Funeral Home in Tech City, two of the most incredible individuals I've ever met. They took an opportunity. I began working family services with them, funeral pre-need, then worked some of the marketing with Michael Milo and some of the other individuals there. And then the economy transitioned. And so I was left with, I don't have much time here. And so a friend of mine knew Katie Caldwell from Legacy Community Health, started working there. my role transition there, and I came to Community Health Network, and I've been here ever since.
And I can tell you really enjoy it. Tell me what's the favorite part about what you're doing?
I don't have direct patient care, and that is probably one of the most challenging things for me, because I don't get to see patients' lives changed the way that our providers do, our nurse practitioners, or our direct patient care team providers. But I do get to see families that do receive that care at school fairs, at health fairs, at various community events, and say, oh yes, we're familiar with you. We brought our child there. We were unable to get our child at their primary care provider. They're now seeing Dr. So-and-so at Dr. Jackson at the League City location, or they're seeing Dr. Poindexter for their OB-GYN care, or they're seeing Demi Minter for mental health care, or whatever that case, whatever provider of their choice is. So even though I don't see patients' lives transformed and changed before my very eyes as a result of the care that we provide, I do see the outcome. I do see those families saying, thank you so much for all that you all do for the community, and thank you so much for doing this for my child. If it were not for you all, we likely would not have another provider, because of, number one, because they don't have access to care, or because they don't have insurance, or because of XYZ. During Hurricane Harvey, the demand for health services grew exponentially in Brazoria County. And when I reference a lot to Brazoria County because that is where our flagship health center is, and that's where a lot of the community collaboration began. During Hurricane Harvey, we then began to expand to other providers. So a lot of the other things that we do are collaborative health centers. We have a health center, the Brazoria County Dream Center. We have various health centers throughout other collaborative partners. We entered into a partnership with the Salvation Army of Brazoria County. And through that partnership, we became connected with an individual. I will not disclose this individual's name because of various reasons. But this individual lost his job because of health reasons. This individual was severely obese. He had extensive comorbidities, and those comorbidities prohibited him from truly living a more successful life. He was a truck driver by trade. And so for those of you that, are in the truck driving industry or are familiar with it, you have to pass, your annual exam. And so I think it's actually more than just an annual exam. I think they do this twice a year. I'm not really sure, so don't quote me on it. But this individual could not pass his annual exam. And so because he couldn't pass his annual exam, he could not get his CDL renewed. That was his livelihood. He had no other way to access for any financial services. So when he lost his job, he lost his livelihood. He had no place to stay. He had no groceries to eat, and found himself at the Salvation Army. Through our relationship with the Salvation Army and us going to provide services and care at that location, this individual was able to get access to care, get his comorbidities in control, reapply for his CDL license, and now he's back on the road. Now he's living his life.
Awesome.
There's another individual, a kid whose family, who's really in a unique situation. This individual is in the process of being adopted, but because of this individual's relationship with the I don't know if it's his foster mother or guardian or how that works. There was a lot of moments of crisis where the child just didn't want to stay there and experienced a lot of mental health challenges. And because of this individual, that helped us really begin the process of designing a crisis prevention program. And so, yes, are the numbers important to us? Yes, the numbers are important to us. But what is more important? That individuals have access to care, and that their lives are positively impacted, and that there are tangible outcomes, tangible, sustainable outcomes to the individual. It's another reason why we focus on social determinants of health. When you look at individuals accessing care, some of the challenges that they face are, number one, affordability, cost for health services. This is something right now that's a talking point at the state, at the county, and right now at the federal level. You hear about transportation challenges. Our counties, while we have great resources in our county, one of the biggest barriers that our patients and our community is challenged and faces every day is transportation. Some have the resources, financial resources, and can get to point A to point B to get their medical care or health services taken care of, but some don't.
Yeah.
So transportation is an issue. The other portion is education. We have some really great education institutions, some of the best school districts in the state, some of the best higher education institutions in the nation are in our area. But you have individuals who are either first generation Americans whose parents aren't familiar with the process. And so that becomes a challenge. So education and access to education becomes a social determinant of health. And then as well as you've got to look at culture. You can give everybody all the resources that they need, but if they go back home and their culture is not changing, the likelihood of their life being positively impacted as a result of the resources that you give them decreases significantly. And so those are just some of the social determinants of health that we focus on as well. So yes, health services, yes, mental health, pediatrics, behavioral health, pharmacy, and all that. But also, what are some of the barriers that our patients are facing that we can help address? Transportation, food insecurity, education, low-cost healthcare, affordability of healthcare services, quality health services. So those are some of the really positive outcomes that we have seen in our healthcare and healthcare centers, as well as some of our patients.
Well, our community's better off for having you guys in it. So thank you.
Well, thank you so much. We appreciate it.
So what would you like? What's one thing you want to tell the audience about your organization that they may not know?
I think the biggest misconception that individuals have about our organization, number one, is that we solely focus on health. And while that is true, we are a community health network. The latter part is more relevant to who we are. We are a network of opportunity. We are a network of access. So whether you're accessing, like I said, primary care services, you're also going to get access to behavioral health. A lot of people don't realize that we offer behavioral health services. Mind you, our behavioral health department grew by more than 33% in the last year or so. So, I mean, you see the demand. People also don't know that you can access pharmacy services at all our locations. Our League City campus has a full service pharmacy, and our Scarsdale location has a full service pharmacy. And for those who are in the community that do not live in the Clear Lake area, most of our other locations have access to it as well. So when you think of community health, don't think of just primary care. Also think of us as your whole person care facility. We want to serve you and your entire family.
Well, thank you. It's been very enlightening. I appreciate it.
Thank you so much, Jameson.